Amanda was struggling with chronic headaches when she discovered quick care telemedicine through a targeted Facebook advertisement. The platform promised convenient online consultations with board-certified doctors who could diagnose and treat conditions remotely. Get expert medical care from the comfort of your home, the advertisement proclaimed. Our licensed physicians provide comprehensive telehealth services with same-day appointments and prescription delivery. Amanda felt frustrated with long wait times at traditional clinics and was attracted to the convenience of remote medical consultations. She scheduled an appointment through their user-friendly app and spoke with someone claiming to be Dr. Algernon, who appeared professional and knowledgeable during their video consultation. Based on your symptoms, I believe you're experiencing tension headaches caused by stress and poor posture, Dr. Algernon diagnosed confidently. I'm prescribing a specialized pain management protocol that will provide immediate relief and prevent future episodes. Dr. Algernon prescribed expensive compound medications that weren't available at regular pharmacies, directing Amanda to use Quick Care's affiliated online pharmacy for fulfillment. The medications cost $400 but promise superior effectiveness compared to standard headache treatments available elsewhere. Amanda felt hopeful about finding relief and trusted Dr. Algernon's professional assessment and specialized treatment approach for her chronic condition. The prescribed medications provided no relief and actually worsened her symptoms, causing nausea and dizziness that interfered with her daily activities. When Amanda tried to contact Dr. Algernon for follow-up care, she discovered that his phone numbers were disconnected and the Quick Care platform had become inaccessible. Investigation revealed that Dr. Algernon had no medical license and Quick Care was operating without proper healthcare licensing or regulatory oversight. The expensive medications were generic supplements marked up dramatically and sold through their fraudulent online pharmacy system. Amanda lost her $400 and suffered health complications that required legitimate medical treatment to resolve safely. She learned that legitimate telehealth services are provided by licensed physicians with verifiable credentials working through regulated healthcare platforms. Marcus was seeking mental health support when he found mind wellness therapy through an online search for affordable counseling services. The platform advertised licensed therapists who provided convenient online therapy sessions for anxiety, depression, and relationship issues. Professional mental health care that fits your schedule and budget, the website proclaimed. Our experienced therapists help thousands of patients achieve emotional wellness through evidence-based online therapy sessions. Marcus felt overwhelmed by work stress and was attracted to the accessibility and affordability of remote therapy services. He completed their online assessment and was matched with someone claiming to be Dr. Barnabas, a licensed clinical psychologist with expertise in anxiety disorders. Your assessment indicates moderate anxiety that can be effectively treated through our specialized cognitive behavioral therapy program, Dr. Barnabas explained during their initial video session. I've helped hundreds of patients overcome similar challenges using proven therapeutic techniques designed specifically for online delivery. Dr. Barnabas recommended an intensive 8-week therapy program that cost $1,200 but promised significant improvement in Marcus's anxiety symptoms and overall mental health. The program included weekly therapy sessions, personalized treatment plans, and access to therapeutic resources designed specifically for anxiety management. Marcus felt hopeful about addressing his mental health concerns and decided to invest in the comprehensive therapy program through Mind Wellness. The therapy sessions consisted of generic self-help advice rather than evidence-based therapeutic interventions, with no personalized treatment planning or professional psychological assessment. Dr. Barnabas often seemed unprepared during sessions and provided conflicting advice that didn't align with established therapeutic practices or anxiety treatment protocols. When Marcus's anxiety worsened and he requested additional support, Dr. Barnabas became dismissive and blamed Marcus for not following the treatment plan correctly. Investigation revealed that Dr. Barnabas had no psychology license or mental health credentials, and Mind Wellness was operating without proper healthcare licensing. Marcus lost his $1,200 and experienced worsening mental health symptoms that required legitimate therapy to address properly. He learned that authentic online therapy requires licensed mental health professionals working through regulated healthcare platforms with proper oversight and accountability. Charlotte was concerned about unusual skin symptoms when she discovered DermCheck online through a health forum recommendation. The platform promised expert dermatological consultations through photo analysis and video consultations with board-certified dermatologists. Get professional skincare diagnosis without waiting weeks for appointments, the service advertised. Our dermatology experts provide accurate diagnoses and treatment recommendations through advanced telehealth technology and professional medical assessment. Charlotte felt worried about her skin changes and appreciated the promise of quick professional evaluation without lengthy appointment delays. She uploaded photos of her skin concerns and scheduled a consultation with someone claiming to be Dr. Benedict, a board-certified dermatologist with 20 years of experience. Based on your photos and medical history, you're experiencing a common inflammatory condition that responds well to targeted treatment, Dr. Benedict diagnosed during their video consultation. I'm recommending a specialized topical treatment protocol that will clear your skin completely within 4 weeks of consistent application. Dr. Benedict prescribed expensive custom compounded creams that cost $600 but promised superior results compared to standard dermatological treatments available through regular channels. The creams had to be ordered through DermCheck's affiliated specialty pharmacy, which claimed to use advanced formulation techniques for maximum effectiveness. Charlotte felt relieved to have a professional diagnosis and trusted Dr. Benedict's expertise and specialized treatment recommendations for her skin concerns. The prescribed creams caused severe allergic reactions that worsened her skin condition significantly, resulting in painful inflammation and scarring that required emergency medical attention. When Charlotte tried to contact Dr. Benedict about the adverse reactions, she discovered that his contact information was fake and DermCheck had disappeared completely. Investigation revealed that Dr. Benedict had no dermatology license or medical credentials, and the specialty pharmacy was selling generic products marked up dramatically. Charlotte lost her $600 and suffered skin damage that required extensive legitimate dermatological treatment to repair safely. She learned that legitimate telehealth dermatology requires licensed physicians with verifiable credentials working through regulated healthcare platforms with proper patient safety protocols. Benjamin was struggling with sleep issues when he found SleepWell telemedicine through a targeted advertisement on a health website. The platform promised specialized sleep medicine consultations with board-certified sleep specialists who could diagnose and treat sleep disorders remotely. Resolve your sleep problems with expert medical care from home, the advertisement claimed. Our sleep medicine specialists provide comprehensive evaluations and personalized treatment plans that help patients achieve restorative sleep naturally. Benjamin felt exhausted from chronic insomnia and was attracted to the convenience of remote sleep medicine consultation without requiring overnight sleep studies. He completed their comprehensive sleep assessment and consulted with someone claiming to be Dr. Beauregard, a board-certified sleep medicine specialist with extensive experience treating sleep disorders. Your assessment indicates sleep onset insomnia combined with anxiety-related sleep disturbance, Dr. Beauregard diagnosed confidently. I'm prescribing a revolutionary sleep optimization protocol that addresses both the physical and psychological factors affecting your sleep quality. Dr. Beauregard recommended expensive natural sleep supplements that cost $800 but promised to restore normal sleep patterns without the side effects of traditional sleep medications. The supplements were only available through SleepWell's affiliated wellness pharmacy, which claimed to use proprietary formulations based on cutting-edge sleep research. Benjamin felt hopeful about finding natural sleep solutions and trusted Dr. Beauregard's expertise and innovative approach to sleep disorder treatment. The expensive supplements provided no improvement in his sleep quality and actually caused digestive issues that further disrupted his rest and overall health. When Benjamin tried to contact Dr. Beauregard for follow-up care, he discovered that the doctor's credentials were fake and SleepWell had become completely inaccessible. Investigation revealed that Dr. Beauregard had no medical license or sleep medicine certification, and the wellness pharmacy was selling generic supplements at inflated prices. Benjamin lost his $800 and continued suffering from sleep problems that required legitimate medical evaluation and treatment. He learned that authentic sleep medicine requires licensed physicians with specialized training working through accredited healthcare facilities with proper diagnostic capabilities. Diana was experiencing digestive issues when she discovered gut health solutions through a wellness podcast advertisement. The platform claimed to provide specialized gastroenterology consultations with experts who could diagnose and treat digestive disorders through advanced telehealth assessment techniques. Resolve digestive problems with cutting-edge gut health expertise, the advertisement promised. Our gastroenterology specialists use advanced assessment methods to identify root causes and provide personalized treatment protocols that restore optimal digestive function. Diana felt frustrated with ongoing stomach problems and was attracted to the promise of specialized expertise in root cause analysis for her digestive concerns. She completed their detailed health questionnaire and consulted with someone claiming to be Dr. Blake, a gastroenterology specialist with expertise in functional digestive disorders. Your symptoms indicate SIBO combined with leaky gut syndrome, DR. Blake diagnosed after reviewing Diana's information. These conditions require specialized treatment that most conventional doctors don't understand or know how to address effectively. Dr. Blake recommended an expensive gut healing protocol that cost $1,500 and included specialized testing kits, custom probiotics, and personalized dietary supplements. The protocol promised to eliminate her digestive symptoms completely within 8 weeks through targeted treatment of underlying gut dysfunction. Diana felt hopeful about addressing the root causes of her digestive problems and decided to invest in the comprehensive gut healing program. The specialized testing kits were generic stool tests available for much less through legitimate laboratories, with no advanced diagnostic capabilities or professional interpretation. The custom probiotics and dietary supplements were standard products marked up dramatically and sold through their affiliated wellness company. When Diana followed the protocol precisely, her digestive symptoms worsened significantly, causing severe abdominal pain that required emergency medical attention. Investigation revealed that Dr. Blake had no medical license or gastroenterology training and was providing medical diagnoses without proper qualifications or oversight. Diana lost her $1,500 and suffered health complications that required legitimate gastroenterological evaluation and treatment to resolve safely. She learned that authentic digestive disorder treatment requires licensed physicians with specialized training working through accredited healthcare facilities. Emma was concerned about hormonal imbalances when she found Hormone Balance Pro through a women's health blog recommendation. The platform promised comprehensive hormone optimization consultations with specialists who could restore hormonal balance through natural treatment approaches. Optimize your hormones naturally with expert medical guidance, the service advertised. Our hormone specialists provide personalized treatment protocols that address root causes of hormonal imbalance and restore optimal endocrine function safely and effectively. Emma felt frustrated with fatigue and mood swings that she suspected were hormone-related and was attracted to the promise of natural hormone optimization. She completed their comprehensive hormone assessment and consulted with someone claiming to be Dr. Clarence, an endocrinology specialist with expertise in natural hormone balancing. Your symptoms indicate multiple hormone deficiencies that can be corrected through bioidentical hormone replacement and targeted nutritional support, Dr. Clarence diagnosed after reviewing Emma's assessment. Conventional doctors typically prescribe synthetic hormones that create more problems than they solve, while our natural approach restores optimal hormone function safely. Dr. Clarence recommended expensive bioidentical hormone creams and specialized supplements that cost $2,000 but promised to restore Emma's energy and emotional balance within 6 weeks. The treatments were only available through Hormone Balance Pro's affiliated pharmacy, which claimed to use advanced compounding techniques for optimal bioavailability and effectiveness. Emma felt hopeful about addressing her hormonal concerns naturally and decided to invest in the comprehensive hormone optimization program. The bioidentical hormone creams contained no active hormones and were essentially expensive moisturizers with no therapeutic benefit for hormonal concerns. The specialized supplements were basic vitamins marked up dramatically and sold through their fraudulent pharmacy operation with fake medical oversight. When Emma used the treatments as directed, her symptoms worsened and she developed new health problems that required legitimate medical evaluation. Investigation revealed that Dr. Clarence had no medical license or endocrinology training and was providing hormone therapy without proper qualifications or safety monitoring. Emma lost her $2,000 and suffered health complications that required legitimate endocrinological care to address safely. She learned that hormone therapy requires licensed physicians with specialized training and proper laboratory monitoring for patient safety. Ferdinand was seeking pain management when he discovered pain-free telemedicine through an online search for chronic pain treatment. The platform advertised board-certified pain management specialists who could provide comprehensive pain care through telehealth consultations and personalized treatment protocols. Effective pain management from the comfort of your home, the website proclaimed. Our pain specialists help patients achieve lasting relief through innovative treatment approaches that address both pain symptoms and underlying causes. Ferdinand felt frustrated with inadequate pain control from his current treatments and was attracted to the promise of specialized pain management expertise. He completed their pain assessment and consulted with someone claiming to be Dr. Fitzgerald, a board-certified pain management physician with extensive experience treating chronic pain conditions. Your pain pattern indicates central sensitization combined with inflammatory dysfunction, Dr. Fitzgerald diagnosed during their video consultation. This requires specialized treatment protocols that most pain doctors don't understand or have access to through traditional healthcare systems. Dr. Fitzgerald recommended expensive pain relief supplements and specialized devices that cost $1,800 but promise significant pain reduction within 4 weeks of treatment. The products were only available through Pain-Free's affiliated medical supply company, which claimed to provide cutting-edge pain management technology not available elsewhere. Ferdinand felt hopeful about finding effective pain relief and trusted Dr. Fitzgerald's expertise and innovative treatment approach for his chronic condition. The pain relief supplements were generic anti-inflammatory compounds with no special formulation or enhanced effectiveness for chronic pain management. The specialized devices were basic TENS units marked up dramatically and sold through their fraudulent medical supply operation with false claims about effectiveness. When Ferdinand used the treatments as prescribed, his pain levels remained unchanged, and he wasted valuable time pursuing ineffective treatment approaches. Investigation revealed that Dr. Fitzgerald had no medical license or pain management certification and was providing medical treatment without proper qualifications or oversight. Ferdinand lost his $1,800 and continued suffering from chronic pain that required legitimate pain management care. He learned that effective pain management requires licensed physicians with specialized training working through accredited healthcare facilities with proper treatment protocols. Grace was experiencing anxiety symptoms when she found Calmmind telepsychiatry through a mental health app advertisement. The platform promised psychiatric consultations with board-certified psychiatrists who could prescribe medications and provide comprehensive mental health treatment remotely. Professional psychiatric care that fits your lifestyle, the advertisement claimed. Our experienced psychiatrists provide expert diagnosis and medication management for anxiety, depression, and other mental health conditions through convenient telehealth appointments. Grace felt overwhelmed by anxiety that was interfering with her work and relationships and was attracted to the accessibility of remote psychiatric care. She completed their mental health screening and consulted with someone claiming to be Dr. Francisco, a board-certified psychiatrist with expertise in anxiety disorders. Your symptoms meet criteria for generalized anxiety disorder with panic features, DR. Francisco diagnosed during their video session. I'm prescribing a specialized anxiety medication protocol that will provide rapid relief while we work on long-term management strategies. Dr. Francisco prescribed expensive brand-name medications that cost $600 per month but promise superior effectiveness compared to generic alternatives available elsewhere. The medications had to be filled through Calmmind's affiliated specialty pharmacy, which claimed to provide enhanced medication monitoring and patient support services. Grace felt relieved to have professional psychiatric care and trusted Dr. Francisco's expertise and specialized medication recommendations for her anxiety disorder. The prescribed medications were generic antidepressants marked up dramatically with no enhanced effectiveness or specialized formulation for anxiety treatment. The specialty pharmacy provided no medication monitoring or patient support beyond basic prescription fulfillment and billing services. When Grace experienced side effects from the medications, Dr. Francisco became unresponsive and provided no follow-up care or medication adjustments. Investigation revealed that Dr. Francisco had no psychiatric license or medical credentials and was prescribing medications without proper qualifications or safety monitoring. Grace lost thousands of dollars and experienced medication side effects that required legitimate psychiatric care to manage safely. She learned that authentic psychiatric treatment requires licensed physicians with specialized training and proper medication monitoring protocols. Harold was concerned about heart palpitations when he discovered CardioCheck telemedicine through a health screening advertisement. The platform promised cardiovascular consultations with board-certified cardiologists who could evaluate heart symptoms and provide treatment recommendations remotely. Expert cardiac care without the wait, the service advertised. Our cardiologists provide comprehensive heart health evaluations and personalized treatment plans through advanced telehealth technology and professional medical assessment. Harold felt worried about his heart symptoms and appreciated the promise of quick cardiology consultation without lengthy appointment delays. He completed their cardiac risk assessment and consulted with someone claiming to be Dr. Gregory, a board-certified cardiologist with extensive experience in heart rhythm disorders. Your symptoms suggest benign premature ventricular contractions that can be managed effectively with targeted treatment. Dr. Gregory diagnosed after reviewing Harold's information. I'm recommending a specialized cardiac supplement protocol that will regulate your heart rhythm and prevent future episodes safely and naturally. Dr. Gregory prescribed expensive cardiac support supplements that cost $1,200 but promised to eliminate Harold's palpitations within 6 weeks of consistent use. The supplements were only available through CardioCheck's affiliated cardiology pharmacy, which claimed to use pharmaceutical-grade ingredients for maximum cardiovascular benefit. Harold felt relieved to have a professional cardiac evaluation and trusted Dr. Gregory's expertise and natural approach to heart rhythm management. The cardiac support supplements were basic magnesium and potassium compounds with no specialized formulation or enhanced effectiveness for heart rhythm disorders. The cardiology pharmacy was a fraudulent operation selling generic supplements at inflated prices with false claims about pharmaceutical-grade quality. When Harold continued experiencing palpitations despite the supplements, Dr. Gregory became unresponsive and provided no follow-up cardiac care or evaluation. Investigation revealed that Dr. Gregory had no medical license or cardiology certification and was providing cardiac diagnoses without proper qualifications or diagnostic equipment. Harold lost his $1,200 and continued experiencing heart symptoms that required legitimate cardiological evaluation and treatment. He learned that authentic cardiac care requires licensed physicians with specialized training working through accredited healthcare facilities with proper diagnostic capabilities. Isabella was struggling with weight management when she found MetaboBoost Wellness through a weight loss forum recommendation. The platform claimed to provide medical weight loss consultations with specialists who could identify metabolic dysfunction and provide personalized treatment protocols. Lose weight by fixing your metabolism with medical expertise, the service promised. Our metabolic specialists identify underlying causes of weight gain and provide personalized treatment protocols that restore optimal metabolic function for sustainable weight loss. Isabella felt frustrated with unsuccessful diet attempts and was attracted to the promise of addressing metabolic causes of weight gain through medical intervention. She completed their comprehensive metabolic assessment and consulted with someone claiming to be Dr. Ignacio, a metabolic medicine specialist with expertise in weight management disorders. Your assessment indicates insulin resistance combined with thyroid dysfunction and leptin resistance, Dr. Ignacio diagnosed after reviewing Isabella's information. These metabolic imbalances prevent weight loss and require specialized treatment that most doctors don't understand or know how to address effectively. Dr. Ignacio recommended expensive metabolic support supplements and specialized testing that cost $2,000 but promised to restore optimal metabolic function and enable sustainable weight loss. The program included custom meal plans, metabolic supplements, and ongoing monitoring through their affiliated wellness center. Isabella felt hopeful about addressing the root causes of her weight struggles and decided to invest in the comprehensive metabolic restoration program. The metabolic support supplements were basic vitamins and minerals marked up dramatically with no specialized formulation or enhanced effectiveness for weight management. The specialized testing was generic blood work available for much less through legitimate laboratories, with no advanced metabolic assessment capabilities. When Isabella followed the program precisely, she experienced no weight loss and actually gained weight due to the high-calorie meal plans they provided. Investigation revealed that Dr. Ignacio had no medical license or metabolic medicine training and was providing medical diagnoses without proper qualifications. Isabella lost her $2,000 and continued struggling with weight management that required legitimate medical evaluation and treatment. She learned that authentic weight management medicine requires licensed physicians with specialized training and evidence-based treatment approaches. Jackson was experiencing chronic fatigue when he discovered Energy Restore Clinic through a chronic illness support group recommendation. The platform promised consultations with specialists who could identify underlying causes of fatigue and provide comprehensive treatment protocols. Restore your energy with expert medical guidance. The service advertised. Our fatigue specialists use advanced diagnostic methods to identify root causes of chronic fatigue and provide personalized treatment protocols that restore optimal energy and vitality. Jackson felt desperate after months of unexplained exhaustion that was affecting his work and relationships, and was attracted to the promise of specialized expertise for chronic fatigue. He completed their comprehensive fatigue assessment and consulted with someone claiming to be Dr. Janet, a chronic fatigue specialist with expertise in complex medical conditions. Your symptoms indicate chronic fatigue syndrome combined with adrenal dysfunction and mitochondrial impairment, Dr. Janet diagnosed after reviewing Jackson's assessment. These conditions require specialized treatment protocols that conventional doctors typically miss or misdiagnose, leading to years of ineffective treatment. Dr. Janet recommended expensive nutritional IV therapy sessions and specialized supplements that cost $3,000 but promised to restore Jackson's energy levels within 8 weeks. The treatment program included weekly 4 infusions at their affiliated wellness center, along with custom supplement protocols designed specifically for chronic fatigue recovery. Jackson felt hopeful about finding effective treatment and decided to invest in the comprehensive energy restoration program, despite the significant cost. The nutritional IV therapy sessions were basic saline solutions with minimal vitamins, providing no therapeutic benefit for chronic fatigue or energy restoration. The specialized supplements were generic vitamins marked up dramatically and sold through their fraudulent wellness operation with false medical oversight. When Jackson completed the treatment program, his fatigue symptoms remained unchanged, and he had wasted valuable time pursuing ineffective treatments. Investigation revealed that Dr. Janet had no medical license or chronic fatigue expertise and was providing medical treatment without proper qualifications. Jackson lost his $3,000 and continued suffering from chronic fatigue that required legitimate medical evaluation and treatment. He learned that chronic fatigue syndrome requires licensed physicians with specialized training and evidence-based diagnostic approaches. Kenneth was concerned about cognitive decline when he found Brain Boost Neurology through a brain health website advertisement. The platform promised neurological consultations with specialists who could evaluate cognitive symptoms and provide brain optimization treatment protocols. Optimize your brain function with expert neurological care, the advertisement claimed. Our neurology specialists provide comprehensive cognitive evaluations and personalized treatment plans that enhance memory, focus, and overall brain performance through advanced neuroscience approaches. Kenneth felt worried about memory problems and concentration difficulties that seemed to be worsening, and was attracted to the promise of brain optimization through neurological expertise. He completed their cognitive assessment and consulted with someone claiming to be Dr. Leroy, a board-certified neurologist with expertise in cognitive enhancement and brain health. Your assessment indicates early cognitive decline that can be reversed through targeted neuroplasticity training and brain nutrition protocols, Dr. Leroy diagnosed during their consultation. Most neurologists only treat severe dementia, while our approach focuses on preventing and reversing early cognitive changes through cutting-edge neuroscience interventions. Dr. Leroy recommended expensive brain training software and nootropic supplements that cost $2,500 but promised to enhance Kenneth's cognitive function significantly within 12 weeks. The program included personalized brain exercises, cognitive supplements, and ongoing monitoring through their affiliated neurology center. Kenneth felt hopeful about preventing cognitive decline and decided to invest in the comprehensive brain optimization program. The brain training software was generic computer games with no scientific backing or proven effectiveness for cognitive enhancement or memory improvement. The nootropic supplements were basic vitamins marked up dramatically with false claims about brain enhancement and cognitive benefits. When Kenneth used the program as directed, his cognitive symptoms remained unchanged and he realized he had purchased worthless products. Investigation revealed that Dr. Leroy had no medical license or neurology certification and was providing neurological diagnoses without proper qualifications. Kenneth lost his $2,500 and continued experiencing cognitive concerns that required legitimate neurological evaluation and treatment. He learned that authentic neurological care requires licensed physicians with specialized training working through accredited healthcare facilities. Lily was experiencing digestive problems when she discovered functional gut solutions through a holistic health blog recommendation. The platform claimed to provide functional medicine consultations with specialists who could identify root causes of digestive disorders through comprehensive testing and treatment. Heal your gut naturally with functional medicine expertise, the service promised. Our functional medicine practitioners use advanced testing to identify underlying causes of digestive dysfunction and provide personalized healing protocols that restore optimal gut health naturally. Lily felt frustrated with conventional treatments that only managed her symptoms without addressing underlying causes, and was attracted to the promise of root cause analysis through functional medicine. She completed their comprehensive gut health assessment and consulted with someone claiming to be Dr. Lysander, a functional medicine practitioner with expertise in digestive disorders. Your symptoms indicate SIBO, candida overgrowth, and intestinal permeability that require comprehensive gut restoration protocols, Dr. Lysander diagnosed after reviewing Lily's assessment. Conventional gastroenterology only treats symptoms, while functional medicine addresses root causes and provides lasting healing rather than temporary symptom management. Dr. Lysander recommended extensive specialty testing and gut healing supplements that cost $4,000 but promised to identify all underlying causes and restore optimal digestive function. The program included comprehensive stool testing, food sensitivity analysis, and custom probiotic protocols through their affiliated functional medicine laboratory. Lily felt hopeful about addressing root causes and decided to invest in the comprehensive gut restoration program, despite the significant expense. The specialty testing was generic laboratory work marked up dramatically with no enhanced diagnostic capabilities or functional medicine analysis. The gut healing supplements were basic probiotics and digestive enzymes available for much less through legitimate sources, with no specialized formulation. When Lily followed the protocols precisely, her digestive symptoms worsened significantly, and she developed new health problems that required emergency medical attention. Investigation revealed that Dr. Lysander had no medical license or functional medicine training and was providing medical diagnoses without proper qualifications. Lily lost her $4,000 and suffered health complications that required legitimate gastroenterological care to resolve safely. She learned that authentic functional medicine requires properly trained practitioners working through regulated healthcare facilities. Magnolia was struggling with hormonal issues when she found Women Wellness Telemedicine through a women's health podcast advertisement. The platform promised comprehensive women's health consultations with specialists who could address hormonal imbalances through natural treatment approaches. Restore hormonal balance naturally with expert women's health care, the advertisement proclaimed. Our women's health specialists provide personalized hormone optimization protocols that address root causes and restore optimal endocrine function safely through natural interventions. Magnolia felt frustrated with mood swings and irregular cycles that were affecting her quality of life and was attracted to the promise of natural hormone balancing. She completed their hormonal health assessment and consulted with someone claiming to be Dr. Marcus, a women's health specialist with expertise in natural hormone therapy. Your symptoms indicate estrogen dominance combined with progesterone deficiency and adrenal fatigue, Dr. Marcus diagnosed after reviewing Magnolia's information. These imbalances require specialized bioidentical hormone therapy and targeted nutritional support that most gynecologists don't understand or provide effectively. Dr. Marcus recommended expensive bioidentical hormone treatments and specialized testing that cost $3,000 but promised to restore Magnolia's hormonal balance within 10 weeks. The program included custom hormone creams, adrenal support supplements, and comprehensive hormone monitoring through their affiliated Women's Health Center. Magnolia felt hopeful about natural hormone restoration and decided to invest in the comprehensive women's wellness program. The bioidentical hormone treatments contained no active hormones and were essentially expensive moisturizers with no therapeutic benefit for hormonal concerns. The specialized testing was basic hormone panels available for much less through legitimate laboratories, with no enhanced analysis or monitoring capabilities. When Magnolia used the treatments as directed, her hormonal symptoms remained unchanged and she wasted valuable time pursuing ineffective interventions. Investigation revealed that Dr. Marcus had no medical license or women's health training and was providing hormone therapy without proper qualifications. Magnolia lost her $3,000 and continued experiencing hormonal problems that required legitimate gynecological care and treatment. She learned that hormone therapy requires licensed physicians with specialized training and proper laboratory monitoring for safety and effectiveness. Maxwell was concerned about athletic performance when he discovered SportsMed Pro through a fitness forum recommendation. The platform claimed to provide sports medicine consultations with specialists who could optimize athletic performance through advanced training and recovery protocols. Maximize your athletic potential with expert sports medicine guidance. The service advertised. Our sports medicine specialists provide personalized performance optimization protocols that enhance training results and prevent injuries through scientific athletic development approaches. Maxwell felt frustrated with training plateaus and was attracted to the promise of sports medicine expertise for performance enhancement and injury prevention. He completed their athletic assessment and consulted with someone claiming to be Dr. Melissa, a sports medicine physician with expertise in performance optimization. Your assessment indicates suboptimal recovery patterns and training inefficiencies that are limiting your performance potential, Dr. Melissa diagnosed after reviewing Maxwell's information. Most trainers and coaches don't understand the physiological principles required for optimal athletic development and injury prevention through scientific training methods. Dr. Melissa recommended expensive performance supplements and specialized training equipment that cost $2,500 but promised to enhance Maxwell's athletic performance significantly within 8 weeks. The program included custom training protocols, recovery supplements, and ongoing performance monitoring through their affiliated sports performance center. Maxwell felt hopeful about breaking through his training plateaus and decided to invest in the comprehensive performance optimization program. The performance supplements were basic protein powders and vitamins marked up dramatically with false claims about athletic enhancement and performance benefits. The specialized training equipment was generic exercise gear available for much less through legitimate sporting goods retailers, with no enhanced effectiveness. When Maxwell followed the protocols precisely, his athletic performance remained unchanged and he realized he had purchased overpriced generic products. Investigation revealed that Dr. Melissa had no medical license or sports medicine training and was providing performance advice without proper qualifications. Maxwell lost his $2,500 and continued struggling with training plateaus that required legitimate sports medicine evaluation and guidance. He learned that authentic sports medicine requires licensed physicians with specialized training in athletic performance and injury prevention. Natalie was experiencing autoimmune symptoms when she found Immune Balance Clinic through an autoimmune support group recommendation. The platform promised consultations with specialists who could identify autoimmune triggers and provide comprehensive treatment protocols for immune system restoration. Heal autoimmune conditions naturally with expert medical guidance, the service claimed. Our autoimmune specialists use advanced testing to identify root causes of immune dysfunction and provide personalized healing protocols that restore optimal immune function safely. Natalie felt frustrated with conventional treatments that only suppressed her immune system without addressing underlying causes, and was attracted to the promise of natural immune restoration. She completed their comprehensive autoimmune assessment and consulted with someone claiming to be Dr. Nicole, an autoimmune specialist with expertise in immune system restoration. Your symptoms indicate leaky gut syndrome triggering molecular mimicry and autoimmune reactivity, Dr. Nicole diagnosed after reviewing Natalie's assessment. Conventional rheumatology only suppresses immune function, while our approach identifies and eliminates triggers, allowing your immune system to heal naturally. Dr. Nicole recommended extensive food sensitivity testing and immune restoration supplements that cost $5,000 but promised to identify all autoimmune triggers and restore normal immune function. The program included comprehensive elimination diets, custom supplement protocols, and ongoing immune monitoring through their affiliated autoimmune center. Natalie felt hopeful about addressing root causes and decided to invest in the comprehensive immune restoration program, despite the significant cost. The food sensitivity testing was generic allergy panels with no scientific validity for identifying autoimmune triggers or immune dysfunction causes. The immune restoration supplements were basic anti-inflammatory compounds marked up dramatically with false claims about autoimmune healing and immune system benefits. When Natalie followed the protocols precisely, her autoimmune symptoms worsened significantly, and she developed new health problems requiring emergency medical attention. Investigation revealed that Dr. Nicole had no medical license or autoimmune expertise and was providing medical treatment without proper qualifications. Natalie lost her $5,000 and suffered health complications that required legitimate rheumatological care to manage safely. She learned that autoimmune conditions require licensed physicians with specialized training and evidence-based treatment approaches. Omar was struggling with hair loss when he discovered Hair Restore telemedicine through a hair loss forum recommendation. The platform promised dermatology consultations with specialists who could diagnose and treat hair loss through comprehensive telehealth evaluations and personalized treatment protocols. Restore your hair naturally with expert dermatology care, the advertisement claimed. Our hair restoration specialists provide accurate diagnoses and effective treatment plans for all types of hair loss through advanced assessment technology and professional dermatological expertise. Omar felt self-conscious about his thinning hair and was attracted to the convenience of remote hair loss consultation without embarrassing in-person appointments. He completed their hair loss assessment and consulted with someone claiming to be Dr. Ophelia, a dermatologist with expertise in hair restoration disorders. Your hair loss indicates androgenic alopecia with scalp inflammation that can be corrected through targeted hair restoration protocols and scalp optimization, Dr. Ophelia diagnosed during their video consultation. Most dermatologists only prescribe standard medications while our approach addresses underlying causes and provides more effective natural solutions for lasting hair restoration. Dr. Ophelia recommended expensive hair growth supplements and scalp treatment products that cost $1,800 but promised to restore Omar's hair within 6 months. The treatments were only available through Hair Restore's affiliated pharmacy, which claimed to provide pharmaceutical-grade compounds for maximum hair restoration effectiveness. Omar felt hopeful about restoring his hair and trusted Dr. Ophelia's expertise and natural treatment approach for his hair loss condition. The hair growth supplements were generic biotin and saw palmetto capsules with no proven effectiveness for hair restoration or scalp health improvement. The scalp treatment products were basic shampoos marked up dramatically with false claims about hair enhancement and follicle stimulation benefits. When Omar used the treatments as directed, his hair loss continued unchanged and he experienced no improvement in hair growth or thickness. Investigation revealed that Dr. Ophelia had no medical license or dermatology training and was providing hair loss treatment without proper qualifications. Omar lost his $1,800 and continued experiencing hair loss that required legitimate dermatological evaluation and treatment. He learned that hair loss requires licensed physicians with specialized training and evidence-based treatment approaches. Patricia was concerned about memory problems when she discovered Cognitive Restore Neurology through a brain health newsletter advertisement. The platform claimed to provide neurological consultations with specialists who could evaluate cognitive decline and provide brain restoration treatment protocols. Reverse memory loss with expert neurological care, the service promised. Our neurology specialists use advanced assessment methods to identify causes of cognitive decline and provide personalized treatment protocols that restore optimal brain function and memory performance. Patricia felt worried about increasing forgetfulness that was affecting her work and daily activities, and was attracted to the promise of brain restoration through neurological expertise. She completed their cognitive assessment and consulted with someone claiming to be Dr. Percival, a neurologist with expertise in cognitive restoration and brain health optimization. Your assessment indicates early Alzheimer's changes that can be reversed through targeted neuroplasticity training and brain nutrition protocols, Dr. Percival diagnosed during their consultation. Most neurologists wait until severe dementia develops, while our approach intervenes early to prevent and reverse cognitive decline through cutting-edge neuroscience interventions. Dr. Percival recommended expensive brain training programs and cognitive supplements that cost $4,000 but promised to restore Patricia's memory function within 16 weeks. The program included personalized cognitive exercises, brain nutrition supplements, and ongoing progress monitoring through their affiliated neurology center. Patricia felt desperate to prevent further cognitive decline and decided to invest in the comprehensive brain restoration program despite the significant expense. The brain training programs were generic computer games with no scientific backing or proven effectiveness for cognitive restoration or memory improvement. The cognitive supplements were basic vitamins marked up dramatically with false claims about brain enhancement and memory benefits. When Patricia completed the program, her memory problems remained unchanged, and she realized she had purchased worthless interventions. Investigation revealed that Dr. Percival had no medical license or neurology certification and was providing neurological diagnoses without proper qualifications. Patricia lost her $4,000 and continued experiencing cognitive concerns that required legitimate neurological evaluation and treatment. She learned that cognitive decline requires licensed neurologists with specialized training working through accredited healthcare facilities. Quincy was experiencing joint pain when he found arthritis relief telemedicine through a pain management forum recommendation. The platform promised rheumatology consultations with specialists who could diagnose and treat arthritis through comprehensive telehealth evaluations and personalized treatment protocols. Eliminate arthritis pain with expert rheumatology care, the service advertised. Our rheumatology specialists provide accurate diagnoses and effective treatment plans for all types of arthritis through advanced telehealth technology and professional medical assessment. Quincy felt frustrated with worsening joint pain that was limiting his mobility and daily activities, and was attracted to the convenience of remote rheumatology consultation. He completed their arthritis assessment and consulted with someone claiming to be Dr. Prudence, a board-certified rheumatologist with expertise in inflammatory arthritis. Your symptoms indicate rheumatoid arthritis with inflammatory markers that require immediate intervention to prevent joint damage. Dr. Prudence diagnosed during their video consultation. I'm prescribing a specialized anti-inflammatory protocol that will reduce inflammation and prevent progression more effectively than conventional treatments. Dr. Prudence recommended expensive natural anti-inflammatory supplements that cost $1,600, but promised to control Quincy's arthritis without the side effects of traditional medications. The supplements were only available through Arthritis Relief's affiliated pharmacy, which claimed to use pharmaceutical-grade natural compounds for maximum effectiveness. Quincy felt hopeful about natural arthritis treatment and trusted Dr. Prudence's expertise and medication-free approach to inflammatory conditions. The natural anti-inflammatory supplements were basic turmeric and fish oil capsules marked up dramatically with no enhanced formulation or proven effectiveness for arthritis treatment. The affiliated pharmacy was a fraudulent operation selling generic supplements at inflated prices with false claims about pharmaceutical-grade quality and medical oversight. When Quincy used the supplements as directed, his joint pain worsened significantly, and he experienced increased stiffness and mobility limitations. Investigation revealed that Dr. Prudence had no medical license or rheumatology certification and was providing arthritis diagnoses without proper qualifications or diagnostic testing. Quincy lost his $1,600 and suffered worsening arthritis symptoms that required legitimate rheumatological evaluation and treatment. He learned that arthritis requires licensed physicians with specialized training and proper diagnostic testing for accurate diagnosis and effective treatment. Rachel was struggling with chronic migraines when she discovered Headache Relief Neurology through a migraine support group recommendation. The platform claimed to provide neurology consultations with specialists who could identify migraine triggers and provide comprehensive headache treatment protocols. Eliminate migraines permanently with expert neurological care, the service promised. Our headache specialists use advanced assessment methods to identify root causes of migraines and provide personalized treatment protocols that prevent headaches naturally without medication dependency. Rachel felt desperate after years of unsuccessful migraine treatments that only provided temporary relief and was attracted to the promise of permanent migraine elimination. She completed their comprehensive headache assessment and consulted with someone claiming to be Dr. Reginald, a neurologist with expertise in migraine elimination and headache disorders. Your migraines are caused by food sensitivities, hormonal imbalances, and cervical spine dysfunction that can be corrected through targeted interventions, Dr. Reginald diagnosed after reviewing Rachel's assessment. Conventional neurologists only prescribe medications that mask symptoms, while our approach eliminates triggers and provides lasting headache freedom through natural healing methods. Dr. Reginald recommended extensive food sensitivity testing and migraine prevention supplements that cost $3,000 but promised to eliminate Rachel's migraines within 12 weeks. The program included elimination diets, custom supplement protocols, and ongoing headache monitoring through their affiliated neurology center. Rachel felt hopeful about finding permanent migraine relief and decided to invest in the comprehensive headache elimination program despite the significant cost. The food sensitivity testing was generic allergy panels with no scientific validity for identifying migraine triggers or headache causes. The migraine prevention supplements were basic magnesium and vitamin compounds marked up dramatically with false claims about headache elimination and neurological benefits. When Rachel followed the protocols precisely, her migraines became more frequent and severe, requiring emergency medical attention for status migrainosus. Investigation revealed that Dr. Reginald had no medical license or neurology certification and was providing neurological treatment without proper qualifications. Rachel lost her $3,000 and suffered worsening migraine symptoms that required legitimate neurological care to manage safely. She learned that migraine treatment requires licensed neurologists with specialized training and evidence-based therapeutic approaches. Robert was concerned about blood pressure when he found cardio-optimal telemedicine through a heart health website advertisement. The platform promised cardiology consultations with specialists who could optimize cardiovascular health through natural blood pressure management and heart health protocols. Optimize your heart health naturally with expert cardiology care, the advertisement claimed. Our cardiology specialists provide personalized cardiovascular optimization protocols that reduce blood pressure and improve heart function through natural interventions without medication side effects. Robert felt worried about high blood pressure readings and was attracted to the promise of natural cardiovascular optimization without pharmaceutical interventions. He completed their cardiovascular assessment and consulted with someone claiming to be Dr. Roderick, a cardiologist with expertise in natural heart health and blood pressure optimization. Your blood pressure elevation indicates early cardiovascular dysfunction that can be reversed through targeted lifestyle interventions and cardiovascular supplements, Dr. Roderick diagnosed during their consultation. Conventional cardiologists immediately prescribe blood pressure medications, while our approach addresses root causes and restores optimal cardiovascular function naturally. Dr. Roderick recommended expensive cardiovascular supplements and heart health protocols that cost $2,200 but promised to normalize Robert's blood pressure within 8 weeks. The program included custom supplement regimens, dietary modifications, and ongoing cardiovascular monitoring through their affiliated cardiology center. Robert felt hopeful about natural blood pressure management and decided to invest in the comprehensive cardiovascular optimization program. The cardiovascular supplements were basic CoQ10 and omega-3 capsules marked up dramatically with no enhanced formulation or proven effectiveness for blood pressure reduction. The heart health protocols were generic lifestyle advice available for free from legitimate cardiovascular education sources, with no personalized medical guidance. When Robert followed the program precisely, his blood pressure remained elevated and he missed opportunities for appropriate medical intervention. Investigation revealed that Dr. Roderick had no medical license or cardiology certification and was providing cardiovascular treatment without proper qualifications. Robert lost his $2,200 and continued experiencing elevated blood pressure that required legitimate cardiological evaluation and treatment. He learned that blood pressure management requires licensed physicians with cardiovascular training and proper medical monitoring for patient safety. Rosalind was experiencing thyroid symptoms when she discovered Thyroid Balance Pro through a thyroid disorder forum recommendation. The platform claimed to provide endocrinology consultations with specialists who could optimize thyroid function through comprehensive testing and natural treatment approaches. Restore optimal thyroid function naturally with expert endocrine care, the service promised. Our thyroid specialists use advanced testing to identify all aspects of thyroid dysfunction and provide personalized treatment protocols that restore optimal thyroid function through natural thyroid support. Rosalind felt frustrated with persistent fatigue and weight gain despite normal thyroid tests from her doctor and was attracted to the promise of comprehensive thyroid evaluation. She completed their detailed thyroid assessment and consulted with someone claiming to be Dr. Russell, an endocrinologist with expertise in comprehensive thyroid optimization. Your symptoms indicate subclinical hypothyroidism with reverse T3 dominance and thyroid autoimmunity that conventional doctors miss, Dr. Russell diagnosed after reviewing Rosalind's information. Standard thyroid tests only measure TSH, while our comprehensive approach evaluates all thyroid markers and provides targeted treatment for optimal thyroid function. Dr. Russell recommended extensive thyroid testing and natural thyroid supplements that cost $2,800 but promised to restore Rosalind's thyroid function within 10 weeks. The program included comprehensive thyroid panels, custom thyroid support formulas, and ongoing thyroid monitoring through their affiliated endocrine center. Rosalind felt hopeful about comprehensive thyroid treatment and decided to invest in the thyroid optimization program despite the significant expense. The extensive thyroid testing was generic laboratory work marked up dramatically with no enhanced diagnostic capabilities or endocrine analysis. The natural thyroid supplements were basic iodine and selenium compounds with no proven effectiveness for thyroid optimization or hormone balance. When Rosalind used the supplements as directed, her thyroid symptoms worsened and she developed new health problems requiring emergency medical attention. Investigation revealed that Dr. Russell had no medical license or endocrinology training and was providing thyroid treatment without proper qualifications. Rosalind lost her $2,800 and suffered thyroid complications that required legitimate endocrinological care to manage safely. She learned that thyroid disorders require licensed physicians with specialized training and proper laboratory monitoring for diagnosis and treatment. Ryan was struggling with depression when he found Mood Wellness telepsychiatry through a mental health app recommendation. The platform promised psychiatric consultations with specialists who could address depression through natural treatment approaches and personalized mental health protocols. Overcome depression naturally with expert psychiatric care, the advertisement proclaimed. Our psychiatrists provide comprehensive mental health evaluations and personalized treatment plans that address root causes of depression through natural interventions and therapeutic support. Ryan felt hesitant about traditional antidepressant medications and was attracted to the promise of natural depression treatment through psychiatric expertise. He completed their mental health screening and consulted with someone claiming to be Dr. Samantha, a psychiatrist with expertise in natural depression treatment. Your depression indicates neurotransmitter imbalances and nutritional deficiencies that can be corrected through targeted amino acid therapy and nutritional psychiatry, Dr. Samantha diagnosed during their video session. Conventional psychiatrists only prescribe antidepressants, while our approach addresses biochemical causes and provides lasting depression relief through natural interventions. Dr. Samantha recommended expensive amino acid supplements and nutritional protocols that cost $1,900 but promised to eliminate Ryan's depression within 8 weeks. The program included custom neurotransmitter support formulas, dietary modifications, and ongoing mental health monitoring through their affiliated psychiatry center. Ryan felt hopeful about natural depression treatment and decided to invest in the comprehensive Mood Wellness program. The amino acid supplements were basic tryptophan and tyrosine capsules marked up dramatically with no proven effectiveness for depression treatment or mood enhancement. The nutritional protocols were generic dietary advice with no psychiatric oversight or evidence-based mental health interventions. When Ryan followed the program precisely, his depression worsened significantly and he experienced suicidal thoughts requiring emergency psychiatric intervention. Investigation revealed that Dr. Samantha had no medical license or psychiatric training and was providing mental health treatment without proper qualifications. Ryan lost his $1,900 and suffered dangerous mental health complications that required legitimate psychiatric care to stabilize safely. He learned that depression requires licensed psychiatrists with specialized training and proper safety monitoring for mental health treatment. Sebastian was experiencing chronic back pain when he discovered Spine Relief Telemedicine through a back pain support forum recommendation. The platform claimed to provide orthopedic consultations with specialists who could diagnose and treat spinal conditions through comprehensive telehealth evaluations and personalized treatment protocols. Eliminate back pain permanently with expert spine care, the service advertised. Our spine specialists provide accurate diagnoses and effective treatment plans for all types of back pain through advanced assessment technology and professional orthopedic expertise. Sebastian felt frustrated with persistent back pain that was limiting his work and recreational activities, and was attracted to the convenience of remote spine consultation. He completed their spine assessment and consulted with someone claiming to be Dr. Sterling, an orthopedic spine specialist with expertise in back pain elimination. Your symptoms indicate disc degeneration with facet joint dysfunction that can be corrected through targeted spinal rehabilitation and anti-inflammatory protocols, Dr. Sterling diagnosed during their video consultation. Most orthopedists recommend surgery, while our approach restores spinal function naturally through comprehensive rehabilitation and targeted interventions. Dr. Sterling recommended expensive spinal supplements and rehabilitation equipment that cost $3,000 but promised to eliminate Sebastian's back pain within 12 weeks. The program included custom exercise protocols, spinal support supplements, and ongoing progress monitoring through their affiliated spine center. Sebastian felt hopeful about non-surgical back pain treatment and decided to invest in the comprehensive spinal restoration program. The spinal supplements were basic glucosamine and chondroitin capsules marked up dramatically with no proven effectiveness for disc degeneration or back pain relief. The rehabilitation equipment was generic exercise gear available for much less through legitimate medical supply companies, with no enhanced therapeutic benefits. When Sebastian followed the protocols precisely, his back pain worsened significantly and he developed new spinal problems requiring emergency orthopedic evaluation. Investigation revealed that Dr. Sterling had no medical license or orthopedic training and was providing spinal diagnoses without proper qualifications or imaging studies. Sebastian lost his $3,000 and suffered worsening back pain that required legitimate orthopedic care to treat safely. He learned that spinal conditions require licensed physicians with specialized training and proper diagnostic imaging for accurate diagnosis and treatment. Stephanie was concerned about irregular heartbeat when she discovered heart rhythm solutions through a cardiac arrhythmia forum recommendation. The platform promised cardiology consultations with specialists who could evaluate heart rhythm disorders and provide treatment protocols through advanced telehealth monitoring and assessment. Restore normal heart rhythm with expert cardiology care, the service claimed. Our cardiac electrophysiologist specialists provide comprehensive rhythm evaluations and personalized treatment plans that restore optimal heart function through targeted interventions and rhythm management. Stephanie felt worried about palpitations and irregular heartbeat that were causing anxiety and sleep disruption, and was attracted to the promise of specialized cardiac rhythm expertise. She completed their cardiac rhythm assessment and consulted with someone claiming to be Dr. Tabitha, a cardiac electrophysiologist with expertise in heart rhythm disorders. Your symptoms indicate atrial fibrillation with ventricular ectopy that requires immediate intervention to prevent stroke and heart failure, Dr. Tabitha diagnosed during their consultation. I'm prescribing a specialized cardiac rhythm protocol that will restore normal heart rhythm more effectively than conventional cardiac medications. Dr. Tabitha recommended expensive cardiac rhythm supplements that cost $2,400 but promised to normalize Stephanie's heart rhythm within 6 weeks. The supplements were only available through Heart Rhythm Solutions' affiliated cardiac pharmacy, which claimed to use pharmaceutical-grade compounds for maximum cardiovascular effectiveness. Stephanie felt alarmed by the diagnosis and trusted Dr. Tabitha's expertise and urgent treatment recommendations for her serious cardiac condition. The cardiac rhythm supplements were basic magnesium and potassium compounds with no proven effectiveness for arrhythmia treatment or heart rhythm management. The cardiac pharmacy was a fraudulent operation selling generic supplements at inflated prices with false claims about pharmaceutical-grade quality. When Stephanie used the supplements as directed, her heart rhythm symptoms persisted and she continued experiencing palpitations and anxiety. Investigation revealed that Dr. Tabitha had no medical license or cardiology certification and was providing cardiac diagnoses without proper qualifications or cardiac monitoring equipment. Stephanie lost her $2,400 and continued experiencing heart rhythm problems that required legitimate cardiological evaluation and treatment. She learned that heart rhythm disorders require licensed cardiologists with specialized training and proper cardiac monitoring for accurate diagnosis and safe treatment. Thaddeus was struggling with kidney function when he found Renal Restore Nephrology through a kidney disease support group recommendation. The platform claimed to provide nephrology consultations with specialists who could optimize kidney function through natural treatment approaches and renal health protocols. Restore kidney function naturally with expert nephrology care, the service promised. Our kidney specialists use advanced assessment methods to identify causes of kidney dysfunction and provide personalized treatment protocols that restore optimal renal function through natural interventions. Thaddeus felt worried about declining kidney function shown in his recent lab work and was attracted to the promise of natural kidney restoration through nephrology expertise. He completed their comprehensive kidney assessment and consulted with someone claiming to be Dr. Trevor, a nephrologist with expertise in natural kidney function optimization. Your kidney function decline indicates early chronic kidney disease that can be reversed through targeted nutritional therapy and renal support protocols, Dr. Trevor diagnosed after reviewing Thaddeus's laboratory results. Conventional nephrologists only monitor kidney decline, while our approach actively restores kidney function through natural interventions and targeted nutritional support. Dr. Trevor recommended expensive kidney support supplements and renal detoxification protocols that cost $3,500 but promised to restore Thaddeus's kidney function within 16 weeks. The program included custom supplement regimens, dietary modifications, and ongoing kidney monitoring through their affiliated nephrology center. Thaddeus felt hopeful about natural kidney restoration and decided to invest in the comprehensive renal optimization program, despite the significant cost. The kidney support supplements were basic cranberry and dandelion extracts marked up dramatically with no proven effectiveness for kidney function improvement or renal health. The renal detoxification protocols were potentially dangerous dietary restrictions that could worsen kidney function and cause electrolyte imbalances. When Thaddeus followed the protocols precisely, his kidney function deteriorated further, and he required emergency medical intervention for acute kidney injury. Investigation revealed that Dr. Trevor had no medical license or nephrology training and was providing kidney treatment without proper qualifications. Thaddeus lost his $3,500 and suffered kidney complications that required legitimate nephrological care to manage safely. He learned that kidney disease requires licensed physicians with specialized training and careful medical monitoring for patient safety. Tyler was experiencing vision problems when he discovered eye health telemedicine through an eye care website advertisement. The platform promised ophthalmology consultations with specialists who could evaluate vision concerns through comprehensive telehealth eye examinations and personalized treatment protocols. Protect your vision with expert eye care from home, the advertisement claimed. Our ophthalmology specialists provide thorough eye evaluations and effective treatment plans for vision problems through advanced telehealth technology and professional eye care expertise. Tyler felt concerned about blurry vision that was affecting his work and daily activities, and was attracted to the convenience of remote eye care consultation. He completed their vision assessment and consulted with someone claiming to be Dr. Vanessa, an ophthalmologist with expertise in vision disorders and eye health optimization. Your symptoms indicate early macular degeneration with retinal inflammation that requires immediate intervention to prevent vision loss, Dr. Vanessa diagnosed during their video consultation. I'm prescribing specialized eye vitamins and vision protection protocols that will preserve your sight more effectively than conventional treatments. Dr. Vanessa recommended expensive eye health supplements that cost $2,600 but promised to protect Tyler's vision and prevent further deterioration within 8 weeks. The supplements were only available through Eye Health's affiliated optical pharmacy, which claimed to use pharmaceutical-grade nutrients for maximum eye protection effectiveness. Tyler felt alarmed by the diagnosis and trusted Dr. Vanessa's expertise and urgent treatment recommendations for his serious vision condition. The eye health supplements were basic lutein and zeaxanthin capsules marked up dramatically with no proven effectiveness for macular degeneration or vision protection. The optical pharmacy was a fraudulent operation selling generic supplements at inflated prices with false claims about pharmaceutical-grade quality. When Tyler used the supplements as directed, his vision problems persisted and he continued experiencing blurry vision and eye strain. Investigation revealed that Dr. Vanessa had no medical license or ophthalmology certification and was providing eye diagnoses without proper qualifications or eye examination equipment. Tyler lost his $2,600 and continued experiencing vision problems that required legitimate ophthalmological evaluation and treatment. He learned that vision problems require licensed physicians with specialized training and proper eye examination equipment for accurate diagnosis and safe treatment. Veronica was concerned about memory loss when she discovered brain health neurology through a cognitive health newsletter advertisement. The platform claimed to provide neurology consultations with specialists who could evaluate cognitive decline and provide brain protection protocols through advanced assessment and neuroprotective interventions. Protect your brain from memory loss with expert neurological care, the service promised. Our neurology specialists use cutting-edge assessment methods to identify cognitive risks and provide personalized brain protection protocols that prevent memory decline and optimize cognitive function naturally. Veronica felt worried about increasing forgetfulness that seemed to be affecting her work performance and daily functioning, and was attracted to the promise of brain protection through neurological expertise. She completed their cognitive health assessment and consulted with someone claiming to be Dr. Victor, a neurologist with expertise in cognitive protection and brain health optimization. Your assessment indicates early neurodegenerative changes with inflammatory markers that can be prevented through targeted neuroprotective therapy and brain optimization protocols, Dr. Victor diagnosed during their consultation. Most neurologists wait until severe dementia develops, while our approach intervenes early to prevent cognitive decline through advanced neuroprotective interventions. Dr. Victor recommended expensive brain protection supplements and cognitive enhancement protocols that cost $4,000, but promised to prevent further memory loss and optimize Veronica's cognitive function. The program included neuroprotective supplements, cognitive training programs, and ongoing brain health monitoring through their affiliated neurology center. Veronica felt desperate to prevent cognitive decline and decided to invest in the comprehensive brain protection program despite the significant cost. The brain protection supplements were basic antioxidants marked up dramatically with false claims about neuroprotective benefits and cognitive enhancement. The cognitive enhancement protocols were generic brain training games with no scientific backing or proven effectiveness for preventing cognitive decline. When Veronica completed the program, her memory problems remained unchanged, and she realized she had purchased worthless interventions. Investigation revealed that Dr. Victor had no medical license or neurology certification and was providing neurological treatment without proper qualifications. Veronica lost her $4,000 and continued experiencing memory concerns that required legitimate neurological evaluation and assessment. She learned that cognitive health requires licensed neurologists with specialized training working through accredited healthcare facilities with proper diagnostic capabilities. Wayne was struggling with chronic fatigue when he discovered Energy Optimal Wellness through a chronic illness support forum recommendation. The platform claimed to provide consultations with specialists who could identify underlying causes of fatigue and provide comprehensive energy restoration protocols through advanced testing and treatment. Restore your energy naturally with expert medical guidance, the service advertised. Our fatigue specialists use comprehensive testing to identify root causes of chronic fatigue and provide personalized treatment protocols that restore optimal energy and vitality through targeted interventions. Wayne felt exhausted despite adequate sleep and was attracted to the promise of identifying underlying causes of his persistent fatigue through comprehensive medical evaluation. He completed their detailed fatigue assessment and consulted with someone claiming to be Dr. Wilhelmina, a chronic fatigue specialist with expertise in energy restoration and metabolic optimization. Your symptoms indicate mitochondrial dysfunction with adrenal insufficiency and chronic inflammatory response that requires comprehensive restoration protocols, Dr. Wilhelmina diagnosed after reviewing Wayne's assessment. Conventional doctors typically miss these underlying causes, while our approach identifies and treats all factors contributing to chronic fatigue and energy depletion. Dr. Wilhelmina recommended extensive specialty testing and energy restoration supplements that cost $5,000 but promised to restore Wayne's energy levels within 12 weeks. The program included mitochondrial support protocols, adrenal restoration therapy, and ongoing energy monitoring through their affiliated wellness center. Wayne felt hopeful about addressing underlying causes and decided to invest in the comprehensive energy optimization program, despite the significant expense. The specialty testing was generic blood work marked up dramatically with no enhanced diagnostic capabilities or fatigue-specific analysis. The energy restoration supplements were basic B vitamins and adaptogens with no proven effectiveness for chronic fatigue or energy enhancement. When Wayne followed the protocols precisely, his fatigue symptoms remained unchanged, and he continued experiencing exhaustion that affected his daily functioning. Investigation revealed that Dr. Wilhelmina had no medical license or fatigue expertise and was providing medical diagnoses without proper qualifications. Wayne lost his $5,000 and continued suffering from chronic fatigue that required legitimate medical evaluation and treatment. He learned that chronic fatigue requires licensed physicians with specialized training and evidence-based diagnostic approaches for proper evaluation and treatment. Zoe was experiencing hearing problems when she found AudioCare telemedicine through a hearing loss support forum recommendation. The platform promised audiology consultations with specialists who could evaluate hearing concerns through comprehensive telehealth assessments and personalized treatment protocols. Improve your hearing with expert audiology care from home, the service claimed. Our audiology specialists use advanced assessment methods to identify hearing problems and provide personalized treatment protocols that restore optimal hearing function through targeted interventions. Zoe felt frustrated with gradual hearing loss that was affecting her work meetings and social interactions, and was attracted to the convenience of remote hearing evaluation. She completed their comprehensive hearing assessment and consulted with someone claiming to be Dr. Zara, an audiologist with expertise in hearing restoration and auditory health optimization. Your assessment indicates sensory neural hearing loss with auditory processing dysfunction that can be improved through targeted auditory training and hearing enhancement protocols, Dr. Zara diagnosed after reviewing Zoe's information. Conventional audiologists only recommend hearing aids, while our approach addresses underlying causes and restores natural hearing function through comprehensive auditory rehabilitation. Dr. Zara recommended expensive hearing supplements and auditory training programs that cost $4,000 but promised to improve Zoe's hearing within 6 months. The program included specialized hearing exercises, auditory supplements, and ongoing hearing monitoring through their affiliated audiology center. Zoe felt hopeful about hearing improvement and decided to invest in the comprehensive auditory restoration program. The hearing supplements were basic ginkgo and zinc compounds with no proven effectiveness for hearing loss or auditory function enhancement. The auditory training programs were generic listening exercises with no evidence-based hearing rehabilitation or qualified audiological guidance. When Zoe followed the protocols precisely, her hearing remained unchanged and she wasted valuable time pursuing ineffective treatments for her hearing concerns. Investigation revealed that Dr. Zara had no audiology license or hearing healthcare training and was providing hearing treatment without proper qualifications. Zoe lost her $4,000 and continued experiencing hearing problems that required legitimate audiological evaluation and treatment. She learned that hearing loss requires licensed audiologists with specialized training and proper hearing assessment equipment for effective evaluation and treatment. Thank you for joining me tonight on Drowsy Tales Daily. And may these stories guide you into peaceful sleep with renewed awareness of the importance of telehealth accountability and protecting patients from online medical providers that would exploit their trust during vulnerable health situations. Sweet dreams. And I'll see you tomorrow night for another collection of fascinating Reddit stories designed to help you drift off to sleep.